32 minutes after 8. Let's talk some candidiasis now with Dr. Richard Quainoo, who's a naturopath. Good morning to you. Welcome to the show.
Good morning, my dear.
So we're talking candidiasis. I'm sure you've seen many cases. What are the common reports that you get?
Thank you very much. When you talk about candidiasis, it's a type of infection, and it is caused by candida. But there are different species of candida. And then basically it's a yeast infection. And sometimes it can be very worrisome because candidiasis can trigger a whole array of diseases that sometimes even doctors tend to diagnose it wrongly, because candida can affect almost every part of the body. Candida can affect the mouth. When it affects the mouth, it's called thrush. It can affect the throat. It can even enter into the esophagus, where it can develop into esophagitis, inflammation of the esophagus. It can affect the respiratory system. It can affect the ears, the toes, nails, the reproductive, that is the genitalia, both men and women. It's something very, very serious when we are looking generally at candida infection.
Okay.
Yeah.
So what's the common type?
Yeah, the common type is Candida albicans. That is the most common type which affect this thing. But basically, a lot of people, because it cut across all age groups. In fact, even babies tend to develop mouth thrush. At least most of the times, about 6% of babies under 1 year, 1 month old, tend to develop these problems.
In Ghana?
Yes, in Ghana. And then they tend to also reinfect their mother's nipples. And then the nipple will become painful with sore and whatnot. Yes. And diaper rash, that is where the lower buttocks of the child, then the folds also around the thighs can also develop these diaper rash and whatnot. It's the same yeast infection. Okay. Right. And then most women, out of about, when we take about 4 women, 3 out of 4 tend also to develop this candidiasis at least once or twice or more in a year. And then it tends to affect the vaginal cavity with itching, burning sensation, and then the soreness and the discharge like cottage cheese. And it's very, very irritating. Yes. And we also see these candidiasis affecting people with immune compromised condition, people who have weak immune system. Yes. Especially people who are undergoing chemotherapy, like cancer, after cancer, doing cancer treatment. And then the people even who go in for organ transplantation afterwards, they tend to develop, and sometimes even people after surgery tends to develop it. So, and as well as diabetic patients too. Yes, they tend to develop these candidiasis.
Okay.
Yeah.
Is there a way you can know before they are fully blown?
Well, it depends, because of the broadness of the disease condition which candidiasis can cause, because candidiasis in the system can cause constipation, it can cause bad breath, it can cause even depression, mood swings, it can cause skin diseases. Candidiasis can as well cause about something like general weakness and whatnot. Severe sinusitis. There are some people, when you are even sitting down with them, they are not talking, but you could see saying some bad breath from the nostrils. There are some too, when they are talking, because of the thrush, the candida overgrow in the mouth. When they are talking to you, you're saying some bad breath. These are all causes of it. So it depends. Sometimes the patient may not even be aware, because he or she may be having bloated abdomen, indigestion, vomiting, belching, anal itching, and all these things. So he or she doesn't know that this problem is due to candidiasis. And it can even go further to complicate condition like affecting every systemic organ when it enters into the bloodstream. So it's quite something very
Yeah.
serious.
So how do you treat it? How do you begin to treat it?
First and foremost, it depends now the duration of the disease incubation in the patient. Now, when the patient gets to the hospital after diagnosis, then the laboratory diagnosis, then you will know. Well, with women, it's sometimes quite easy, where if the patient comes with vagina itching and whatnot, then maybe laboratory test is recommended, swab, vagina swab or something, then you'll be able to know through the laboratory test. But most often, there may be some bacteria or serious infection at the background. Because when there is a serious bacterial infection in the system and the system becomes weak, then, because naturally, these candida are normal in the system, in the intestinal tracts. They are normal in the system with other bacteria we call the intestinal flora. But when there's imbalance in the body due to maybe certain medication, overuse of antibiotics, that's why we advise patients that you go to the hospital, you see the doctor prescribes medication for you. You don't go back home, finish it. If you have any further complication, go and see the doctor. But then don't go to the chemist shop and then you continue buying your antibiotics that the doctor have prescribed for you for 7 days or for 14 days because you have some of the symptoms you think, oh, you can go and continue. That can cause a lot of problem. Yeah, because this abuse of antibiotics will go there to destroy the friendly bacteria. Then there will be the overgrowth of this candida. Then the system has a major problem.
Okay. So can it be completely treated?
Yeah, it can be completely treated depending on the seriousness of the patient. And I advise the general public as well that when you are a married couple and your wife develops candida, and you don't need to disturb her sexually. Because at that time, when you have sex with her, the moment the semen enters into the birth canal, it changes the acidic medium. Because the birth canal of a woman is more of acidic. Right. So it changes the acidic medium and there will be more itching and whatnot. So most couples even quarrel. You met me last 2-3 days ago, we did something and start itching. It seems you are going out, you are having some external affairs and whatnot, but there's nothing like that. Yes. And secondly too, when it is reoccurring, then there is the need for both couples to see a doctor to address the problem. However, candidiasis is not transferable to a man during sexual intercourse. But where men go and do, excuse me to use the word, leaking and all those things, then there is a problem because it can enter into your throat and then cause a lot of problems. Yes.
Okay.
Yeah. So we candidiasis.
Is there a way that you can prevent it? You can even prevent it from happening in the first place?
It is difficult. Sometimes very, very difficult to prevent. I'm giving a kind of model that you do this and you do that and then you prevent candidiasis infection because but generally when you are healthy and your immune system is sound and you don't abuse sugary products because candida grows in the sugar medium where there's excess sugar more then now and then you are more careful about your diet. I mean, you balance your diet. I believe with a very good immune system, you'll be able to prevent it. That is the basic thing. But when you are sick and you have a weak immune system, you are predisposed to candida infection.
So how prevalent is this situation in Ghana?
Well, I would say a lot of people have candidiasis, but they don't know that they have because of the nature of its broadness. Because it can cause so many things, so many kind of conditions in the body. So the patient may not even know that my bloatedness, my indigestion, my skin itching. I met a case recently, an elderly woman who has some nipple itching, and she thought she is even developing cancer. But I realized that it is just a kind of fungal infection around the nipples, very itching. And sometimes it can come even under the breast and then in between the thighs. So it's quite prevalent, but in the system here, the doctors are doing very well, and it also depends on the patient seeing your doctor for your doctor to diagnose at an early stage. Yes.
You know, sometimes it can be very embarrassing.
Very.
And waking up to go and see a doctor. What would you say to encourage somebody who has a certain situation, but is quite embarrassed about it, especially when you don't know if it's a male doctor or a female doctor you're going to meet?
That is quite interesting. Yes. You don't have to harbor disease and become a friend to any disease. It is most important that the moment you are sick, you have to see a doctor. I have come across cases where people who develop candidiasis can even develop environmental sensitivity. That they go to their offices, and when people who use lavender or anything, they can't even stand it. They start to palpitate, they start to feel like they are sinking because of the overgrowth of candidiasis in their system. They are sitting in their car, the exhaust fumes, they can't breathe. They go to a filling station, even the petrol scent, they can't stand it. They go to market or they cross near a gutter, and then with the stench, they will feel as if they are sinking, something is happening to them, they will start sweat. So it's something, candidiasis is something a lot of people even don't know. And let's consider this situation where somebody has bad breath. I mean, he goes to work, people talk to him, and then they kind of, something. You lose your personality. You can't approach people. You always, when you are talking, you will have to cover your mouth. You have to turn your face. You have to, if you are not careful, you'll not even be able to work in that. Yeah. I met a case, that was my first. I mean, this gentleman he left America and came back to Ghana. He has a case where that systemic candidiasis condition, where it has entered into the blood, he sit down, and when he wake up from the chair, if you come to see that the smell, there's no any discharge in terms of fluid. And he said even when he's in the plane, people sitting around him don't want to sit with him. And imagine somebody that you are not. I met a patient who even want to commit suicide. He's a gentleman. This man has cars, he has whatnot.
Because of an infection?
Because of an infection. Because the smell, the wife could not even sit in the car with him, neither the children. They can't even sit in the same room. He stepped outside and flies will just be dancing and whoozing around his nose.
Wow.
So why do you have to harbor, why do you have to feel shy with this condition? The doctors are there. Go to and see your doctor.
What will be the final tips that you give to anybody watching us right now?
Yeah. What I would advise is we need to cut down on excessive use of sugar. And then we need to take more vegetables and fruits. Somebody may ask, but maybe taking something like pineapple, what's not, contains some kind of fructose sugar. No. Nature, out of its infinite wisdom, has designed these things that when we take these fruits and vegetables, they enter into the system because of the fiber nature of it and whatnot. They don't release the fructose, doesn't enter into the bloodstream faster like when you take the raw sugar. Right. And then we also have to be very careful about abusing drugs. Yes. And when you have a very serious cases, because we see this candida overgrowth in the HIV and then AIDS patients as well. And then people, like I've said, people who have serious weak immune system. Yes. So the moment your candida keep on reoccurring, then you must know that there's something wrong with your system. Okay. So you need to approach it.
All right. I'm grateful that you could make it here on the show today. Thank you very much. That's Dr. Richard Quainoo, who is a naturopath. You're watching the AM show. We've got entertainment coming up. Please stay with us.